Okay, case study. We're looking at bone evaluation. In particular, let's look at three things in particular in this case that we want to look at. We are looking at the constriction of the upper arch and the lower arch, because that's always kind of a vague thing. We have a yellow on the upper arch, and we kind of have a red to orange on the lower arch. We will also look at the ridge height. We have a little bit of a concern about ridge height, or possibly, so that can turn more into a yellow than a green. And last but not least, we can just look at the facial bone. So those are the three things we're looking at in this case. Here we go. This is the panoramic view. Let's look at ridge height. That's the easiest one right now. When we look at the ridge height here, you can see that the bone is coming across. And if we look at the bone on the side that's not being analyzed, which is this side, we're really looking at, he wants an implant in number 30. And you can see how the bone has changed. You can see how it kind of dips down. We have a dip down, and it kind of goes across. But here with teeth, his bone is a lot higher. It kind of ramps up. But when you come here, his bone actually starts to slope down away from this tooth. So if I go premolar, it's getting more of a slope this direction, whereas from the same premolar, he has a slope in this direction. So this turns into more of a yellow, only because it's not going to be a green, because it's actually changing to his opposing side. So it's not exactly the same. It does have a little bit of a concern if you do second molar implants, which I don't do. You can have more of a concern in terms of how high the crown is. In the first molar position, which is fine, I don't mind that at all. That's where I only go to. And we have a decent amount of bone to crown ratio, so we like that. So this is ridge height. I would give them a yellow. The other categories are green, so we're not going to talk about those. Now let's take a look at something else here. We're going to look at the facial bone. If we look at the facial bone, it's mostly concerned around the front teeth. So let's go right down the middle here, right in the front ones, and see what we see. So here, this is actually a green. Look how much bone we have up here on the facial bone. But here's where it gets a little bit tricky. I do see the bone, so I do like this. So this is a green for me, for sure. Not that I'm really all that interested in an immediate implant, but this helps me decide on is, do I truly graft? I bet if this person on the upper lost this tooth and lost this and didn't do any grafting at all, this person would probably maintain their bone height pretty well, because that facial bone is pretty thick. You can see it very well. And you would probably see it too here, because he's got a little pile of bone right there. So I really like that. So I would say that those are greens. And then if you kept looking, you might find some. Let's look at the canine here on the lower. This is where it becomes cautionary. On the canine on the lower, our bone only comes to about here, but it's very thin on the facial bone here on the canine. So this would definitely be a yellow. And it's a yellow because the other part is so green. This now becomes more yellow. So I feel like you got to kind of play a little bit with that, even though you may not see it that clearly on the CT here. I bet this patient actually has more bone, and certainly the facial plate here. So I'm always looking at, like, what is the general trend of this particular patient? If there are greens everywhere else, they got that one side, unless there's an infection or a defect or a fracture or some reason why biologically it's different. There's no reason biologically that this tooth is all that different than all the other teeth. The only case I would give it for is for orthodontics, when they really move the teeth out of the arch. If he did, you have that question with him. He actually did not have orthodontics. I know that for a fact. But if we look at the 3D X-ray here, you see he has a good amount of bone piled up here. And here's where he has just recession. So he has kind of a perio, a little bit of a perio issue of losing some of that bone around the facial plate. But he's an ortho patient. See how his teeth are crossbite? We're not going to categorize him as the ortho patient here, but you can just take a look at that. But he's got a lot of healthy facial bone going along here. And here's where he has that ridge height problem right in here, right? So if we look right into this area, that's where the defect is when he had those teeth extracted or had infections. So that's where we have a little bit of the concern where it has it hide up. But his nerve is so far down, he's agreeing there, so I don't have a concern about that. Okay, last but not least, let's take a look at the constriction. The constriction is actually a difficult one to always nail down. He is a green, he doesn't have a green constriction. And let's look at that. Why is that? It's because his bone kind of goes parallel. It doesn't flare out. And certainly here, that's already turning into a red. So he's on the bottom, this is red or orange, and on the top, that would be a yellow on the front teeth. If I keep going along, I'm going to go, let's say, go back to that canine area. You can see how now this constricts in here. So his constriction comes from this front facial wall of this bone, and that becomes, it's still okay to put the implant in, but I want to mark it as a yellow because I'm very concerned. If I'm concerned and looking at something on the bottom, then I'm definitely going to start marking it on the notes on the assessment sheet. And there's always a place on the assessment sheet for notes, and it happens to be right here on this part right here. So always just write the notes. If we're talking about a concern on the upper lower, on the treatment consultation sheet, it talks about what arch or whatever that we're actually looking at. So you can see the bone is very parallel here and constricts a little less. So you're going to only really run into the red if we're talking about these upper front ones right here on the lower. And now you can really kind of see what I'm talking about in terms of now what's really constricting becomes very narrow. Your implant has to stay at the top of the bone, but then it becomes narrow where we actually need to go wider. And up here you can see how it becomes pretty parallel, and really you have to make sure you nail that bone.